continue to improve with every patient encounter that we have. So that's our front door situation. Our side door situation, if you are sick enough to require an ambulance transport to my facility, same kind of deal. They call ahead. So you kind of have call ahead seating. So they will tell us, hey, this is a 70-year-old gentleman who's presenting with some abdominal pain. He's got these for vital signs. What room do you want us to go to? We immediately assign them a room. We greet them when they enter the door, and we will greet you as well. And we'll hear your story. We'll get you taken care of, get you on the monitor, get your blood taken, get your IV placed, get some medications for pain, and then order a workup. Lots of tests happen in the emergency department. I'm sure anybody who's been to an emergency department realizes when you go there, they're going to run some tests. So because there's no longer a hospital facility, there's no longer competition for the people who run the tests. So radiology and lab, they're all dedicated to me. They do some outpatient stuff, but ultimately, this is where the buck stops, and they know that our emergency patients come first. And so our turnaround times on things like CAT scan and things like blood work are far faster than they are in other facilities. Finally, when we finish your evaluation, determine that you need to be placed in a hospital. Let's just say you're really sick. That stomach ache wasn't just a stomach ache, that was a bowel obstruction, and now you need to have surgery. Let's say your surgeon is at Metro, or your surgeon is over at Fairview. We communicate directly with that individual through our Cleveland Clinic Transfer Center. And one thing the Cleveland Clinic does incredibly well, better than probably any other hospital system in the United States, is patient access. So they've got a whole fleet of people at a call center. We hit a button on the phone, they pick up, and we tell them, we've got to get this patient to Fairview because their surgeon's at Fairview and they need treatment. They will take our information, they'll connect us with that doctor, and at the same time, they'll order your bed and they'll make your transfer arrangements. And then we will get our ambulance that will take you directly to your inpatient bed, just as if you were in that same hospital facility. In fact, it's a secret, don't tell anybody, we get first dibs on beds. So when Fairview is overwhelmed and they are boarding patients for inpatient beds in their emergency department, I get first dibs. Don't tell anyone. But we actually can get patients to their inpatient facility much quicker than some of the other facilities can even admit their own patients. And that's sort of a source of strife and consternation for them, but for you guys, it's a benefit and it's a plus. So the bottom line is we welcome each and every one of you. If you feel you need immediate medical care, I want you to come to my emergency department. I personally welcome you. And if you feel like your visit didn't go as planned and you have any worries or concerns, I want you to reach out to me. We'll definitely have Mr. Fallhaber take my cell phone number and my email address. So if you need to get in touch with me, I want you to tell me how things went. In addition to that, you will also get a survey within 2 weeks of your evaluation, and I want you to tell us honestly, how did things go? How can I make it better for you? Because really my goal is to make sure that each and every person in this room and in this building and in this entire community have access to the best emergency care that they can possibly get. Thank you very much. Yes, ma'am, you have a question?
I have a personal experience which poses the question I'm going to ask you.
Okay.
When I went into the emergency for chest pain, this was, not recently, the staff automatically, she told me, I think it was the doctor herself who told me, if a person over 60, I wouldn't swear on it, but I think she said 60, in any case, it includes all of us here at the Westerly, has chest pain, they immediately get him admitted or her to the hospital. So they didn't even ask me, they admitted me immediately to a room. So in that kind of a situation, it's pretty difficult because you don't know, maybe you should go straight to Fairview or to Lutheran or to wherever, because that's how seriously they took it at that time. I don't know, it's probably changed.
And we still do. No, there's no change. Chest pain is a very serious symptom. It really in any patient, something that we give a lot of thought to, regardless of the age of the patient, because there's a lot of important stuff in your chest. You have lungs, you have a heart, things can go wrong with either one of them. So when we're evaluating a patient with chest pain, we spend a lot of time considering high-risk diagnoses, a heart attack, clots in the lungs, pneumonia, other serious bad things. And if you do require admission, you still can come and see us. Because again, we can get you in a lot quicker. You're not going to wait in the waiting room. You're going to
You can't diagnose yourself.
no, and that's the thing, you can't. And so what I would do is if you have a chest pain complaint, I want you to call 911. And Chief Gilman's guys are really good at what they do. And they can tell you where's the right place for your diagnosis. They can do an EKG right on their ambulance and digitally transmit it to us in the ED at Lakewood or over to Fairview or over to Lutheran. We can review that and make sure there's not an immediate need for a cardiac cath. Make sure you're not having a heart attack. And if you do need to be admitted, we can get you where you need to go.
Which is raises another question. The ambulance expenses for Lakewood is going to go sky high.
Oh, and so that's actually an excellent question. We're talking about what does it cost for a transfer from my emergency department to your inpatient bed. And if you are someone who has Medicare, as I imagine many of you
But
do,
not for the patient, but for the city, the ambulance expenses.
It doesn't change our expenses at all. It doesn't change our, when we determine the fees for the Lakewood Fire Department, we have a billing company that represents clients all over the state. We take that average of what they are, and then we take the low side of the average. So our fees are based on what the rest of the state is doing on the low side of it. When we get a reimbursement, Medicare, Medicaid, it reimburses at a different rate than a private pay insurance. So we know what we're getting. It's not increasing the costs to us substantially at all. Our system is designed, our run volume for Lakewood Fire Department requires 2.1 ambulances. So we staff 3 ambulances all the time. Since the fire department took over EMS in '99, we also staffed 3 fire trucks. So in 1999, you had 1, sometimes 2, most of the time 2, but sometimes only 1 paramedic ambulance available. Now you have 3 paramedic ambulances and 3 paramedic fire trucks. So no matter what happens, is you're getting, you see the fire truck here all the time for ambulance calls. It's because based on the type of call, we always send extra people. And we have always done that since we took over EMS in '99. Now, one of the things to remember in your case of your chest pain, with our connectivity now, the time it takes to get a cardiac cath procedure done has actually been reduced by 18 minutes for the patients that we get reports back on. So we transported over 300 people with chest pain last year. Less than 5% of those actually needed a cardiac cath. Or 10% needed a cardiac cath. Less than 5% of those, that 10% needed to have a stint put in. So when we get them to the hospital, the procedure is done quicker than it used to be when the cath lab was at Lakewood Hospital because they had a shared team. And Dr. Welch can tell you about a patient who are transported to or walk into her ER and how fast that they get it done. So the cost of the ambulance billing is not going to change for the residents. It goes back to the Medicare care. Whatever your insurance pays is what we take.
Yeah, I understand, but with regard to the ambulance cost, are you stating that the change in system, since we are more likely to call 911 than go in ourselves, you mean it will be no additional expense to Lakewood for ambulance service?
No, it's not going to change our budget at all. Our budget of the fire department is still lower than it was when I started as chief in 2000. When we started in 2010, we're operating at a budget lower than our 2010 rate. So
you're going to have to be running all over to Fairview and Lutheran and
we did before. We transported patients out of the city before this happened. It's just a few more patients. It's 20%. Now we take 40% out of it. And of that, a lot of that 40% could be treated at the Lakewood ER, but they've been given this information about what Lakewood ER can do. And that's why we're here, so you can hear what the capabilities of that emergency room are. We have the capacity, volume-wise, manpower-wise, to take those ambulances out of town and still cover our run volume here in the city. The only time, we haven't had to call other ambulances in because we've been out of the city. We've had to call for other ambulances because we were at fires. So our mutual aid in 2016 has been because we were all tied up, all of our companies were tied up in a fire, and we had to have Rocky River or Fairview, in one case Bay Village, come help us for an ambulance call because we were all working at a fire on Hall. And our guys from home had not come back in yet.
Yes, ma'am.
Just wanted to say, I had drove myself there last month, and my experience was great. From the girl at the front to everybody, that it was just really a good experience.
Thank you so much. That's the kind of story that really makes us feel good about the work that we do across the street. Thank you. Yes, ma'am?
I have a question to ask you. What about, I moved here from Parma, and all of my doctors are out of Parma. What do you do in that case if I would be brought to the ER?
Same thing. I'm your humble servant. You tell me you want to go to Parma, I'm going to get you to Parma.
Or to
We
Southwest?
go through the transfer center, we identify a specific physician at Parma. They'll go through their nursing operations manager to get a bed assigned. We'll talk to the doc. Transfer center handles everything. They're literally our one-stop shop for patient access and transfers.
So I don't have to switch doctors?
No, ma'am, you do not. You can keep your own doctor, and if you require hospitalization or specific treatment, we're going to get you exactly where you want to go. And that actually brings up an excellent point. Our goal is to coordinate care with your primary care physician or your specialist. So wherever they are, we can get you where you need to go. Yes, ma'am?
Whenever you said about the communication system, one of the best in the country, now when I go to my primary care doctor, she punches in the little computer in her office, and everything that ever happened to me with her is in that computer. Like, she tells me things I even forgot about, which I want to forget. But now the question is, when you go in the emergency ward, you were talking about communication. Suppose I'm unconscious when I go in, and find out who I am from the people here
Yep.
and my ID. When they punch that in the computer, will all that information that was in my doctor's office come up?
Absolutely. If your doctor is a Cleveland Clinic doctor, excellent. We can identify every single visit you ever had, pull out a problem list, find out your medications, find out your previous hospitalizations, and all the results of all your lab work dating all the way back to 1999 if you're so inclined. So that's really one of the amazing things about the Cleveland Clinic is the goal of one Cleveland Clinic is that we all communicate well with one another. We all share information. And so we do that through our our electronic medical record called Epic. And every visit, you probably notice that your doctor spends a lot of time typing. So, and that's her basically taking your information and allowing it to be shared with people in the future and all your other providers. And so our electronic medical record is one of the best in breed that is available for that use. And I can find out everything I want to know about you in about probably 2 or 3 minutes, depending on how thick your record is.
Now, if I have to be transferred, we'd say, to Fairview Hospital, do they punch that in the computer?
They absolutely do. You name a Cleveland Clinic facility. If you go to Weston, because you're visiting family down in Fort Lauderdale and you need some care down there, if you go to Las Vegas, if you take a plane and fly 7,041 miles all the way to Abu Dhabi, guess what? Your medical record comes with you through Epic. And if you go to a place like Metro that also uses Epic as well, they also have the ability to review the record. So let's say, God forbid, you fall from a very big height and you have 2 broken legs and you have to go to the trauma center to be evaluated to get the best care. They can access your old medical records through Epic. And that's one of the amazing kind of functions of the Cleveland Clinic. No, ma'am. We'll know everything. Again, they'll call, they'll let us know you're coming. As soon as you hit the door and we get your name, we'll take a couple seconds just to review the information. And there's really not a single data point that's salient that I can't get. Yes, ma'am. Oh, I'm sorry, there's 2 of you speaking simultaneously. I'll take the way back there, that's okay. And then we'll come to you next, I'm sorry.
Going to a hospital that's now closed, okay, and if I happen to
information is still being incomplete.
Did you previously attend Huron Road,
Healthspan.
Healthspan? Did you, I think Healthspan is a little bit different, so like those guys are
Repeat the
separate
question,
from us.
Judy. Repeat the question to
Oh, I'm sorry. The question was, if she went to a hospital that was closed, will we have access to those medical records? And so with specific regard to Huron Road, they were a part of the clinic before they closed and they were on Epic, so all those interactions are there. HealthSpan, unfortunately, is not part of the Cleveland Clinic system, and so we wouldn't have access to that documentation, unfortunately.
What would I do?
I would probably do your best to transfer your medical records to a clinic provider. And so if you get access to your old records, they can actually scan them into Epic. And then we'll be able to review those. They'll be saved forever in the computer system. Okay? Yes, ma'am. It depends on what facility you went to. Oh, sorry. She says she's previously from Columbus, Ohio, and wondering how do you get your medical records up here. And so there are certain hospitals that are on the Epic system. About 40% of United States hospitals utilize Epic. So there's a really good chance that where you were previously seen was on that. And so we could go to Care Everywhere, which is just a click button on the computer, and then we could access your old medical records. But probably the safer thing to do is, again, just like I told your friend behind you, is to go ahead and obtain a copy of your medical records, provide them to a Cleveland Clinic physician who will then have their secretary scan it into Epic, and they'll have access to all that information. Oh, sorry. My apologies. Yes, ma'am.
Okay, can you tell me if University Hospital is connected with Epic?
The question is UH connected with Epic? Unfortunately, no. They use a different computer system, one that's a little bit outmoded and cumbersome to use, called Meditech. Unfortunately, we don't have access to their records, but say you came in to see me, what we would do is go ahead and contact the nursing operations manager at a place like St. John's or Elyria, or we'd go directly to medical records at the big hospital, at the main university hospital, and we'd have them fax them over. And frequently they're very responsive, and we get like 70 to 80 pages. With the average patient, we get lots and lots and lots of paper. But we'll go through that, review the salient points, document them in your Cleveland Clinic medical record, and then hand them over to whoever, either to you if you're discharged, or over to the hospital team that's going to be taking over your care. Yes, sir?
Transferred here from Pennsylvania. All my records are in Pennsylvania. And they be transferred over here, or do I have to request them?
You'll have to request them. So you'll have to, because your medical records are considered private health information. So only you can allow them to be released to a healthcare provider. So you have to sign a permission slip. But we can certainly, if you feel like you'd like to be seen by a Cleveland Clinic physician again, go ahead. And when you go to that appointment, you just tell them, I'm from out of state. I would like to establish care with a new doctor. This is who I previously saw. And they can go ahead and make those arrangements to get your records, and again, get them scanned in, make them readily apparent, and then document the most important points in your most recent evaluation. Yes.
Both my doctors used to do that type of stuff. Now I don't know what they are.
Okay.
I go to Dr. Ramirez and Dr. Brownbaugh. One night I had to measure myself. It still hurt in the morning, but. That's wrong.
Yeah, I would agree. So the concern is her doctors previously were Lakewood Hospital doctors, and now she's not entirely certain where they are. So, yeah. So we can definitely help you with that. So Dr. Narcisse in Westlake and Dr. Brombach's in Fairview, so that sounds good. So he found them for you. And I would say, and again, and then the next part of that was she had some chest pain overnight and wasn't sure, should I call for help? And I would say absolutely, especially in your circumstance where you've got a history of cardiac disease and stents. Oh, I'm so sorry to hear that. So what I would recommend is if you do have a serious complaint like chest pain, do not hesitate. Call 911. Better to be safe than sorry. I'm glad that you got better and you're okay. Yeah, no, definitely losing weight helps with chest pain, but I would definitely recommend if anybody has chest pain complaint, shortness of breath, dizziness, lightheadedness, faintness, come and see us. Call 911 if you can't get a ride. If you're really worried and you're feeling very sick, call 911 or ask somebody to help you. Come and see us. And if everything is okay, then you wasted 2 hours of your life you'll never get back. But that's okay. At least you have the reassurance that you're fine. And we can make sure that you're okay. We're here to take care of you. So please, never lay in bed worrying if you should come to the hospital or to the ER. Come and see us and we'll make sure you get the best care. Yes.
The ambulance gentleman and you, I'm sure, they have so many television shows now, Chicago Med and all this. How, when an ambulance comes to get you, of course, I know TV's not always real, but it's pretty real. Being an ambulance person, we'll say I passed out on the sidewalk. What should I have in my purse? What do they look for to identify you so everybody knows that they should have it? What should you have?
Sure. Well, I think if you have a very serious medical condition, something like diabetes, heart disease, stroke, having one of those little bracelets, a life alert type thing, that identifies your medical condition and your name can be very helpful. And then just, if you've got your ID in your purse, that's all they need to identify you. They just need your name, date of birth, and an address. So if you have a license, driver's license, great, because it's all the information we need right there to know exactly who you are, and then we can do the data mining piece on our end to make sure that we get everything correct.
And if you've ridden with us before, our computer system will pull your record up and populate. So we have your name, we'll put you into the computer, and it can bring up, just like their system, it can bring up your patient history. So if you were outside of here, and we take you to the hospital from the westerly, we can get your information, and it populates our computer for us too.
But a driver's license will be a beginning.
If you have a driver's license, even if you have your name, we can always call for a policeman, and then we can run a search by your name and get all the information. If you had a driver's license or a state ID or something like that, we can run that, and have a police officer run that for us to help identify.
Yes, ma'am.
When a Lakewood resident calls 911 regardless of age, how is your system set up? If it's a Lakewood resident, an ambulance comes, do you automatically take them to Lakewood Hospital, or can the patient request, I want to go to Fairview or Lutheran or whatever?
If you call on your cell phone, on a cell phone, cellular phone, one of these, the call goes to Cleveland, who then figures out where you are and transfers that call back to Lakewood Police. If you call 911, it goes right to Lakewood Police. The dispatcher pushes a button and announces what the call is and which ambulance is to respond. So here you get either the ambulance from Kenilworth in Detroit or the ambulance from Warren and Madison. And then when we come here, we do the assessment on you. If you have a preference for a hospital, we try to stay close, but we can take you to whatever is the appropriate hospital. You might tell us you want to go.
Do you take them first to Lakewood Emergency,
No,
or can they go directly to the hospital?
It depends on the injury. If we come up and we find that you were on a certain medication and you took a big fall, and you tell us you wanted to go to Lakewood, we're probably going to say, no, we're going to take you to Metro. Because we're looking to take you to the most appropriate place for your injury. Lakewood Hospital, the Lakewood Emergency Room, is the most appropriate place for most everybody we transport. But both Dr. Welch and I agree that there are some things that we're going to take you directly to another facility.
But does the patient have a right to ask?
The patient does. We take people, we've transported from here today twice to Fairview, I believe.
Yes.
I had an experience like she's asking about. I had to call 911 for him. And when the gentleman came, they asked him some questions, checked him out, and I said, where are you gonna take us? Because I was worried too. And he said, the condition he's in, I think we should go up to Fairview. And I said, okay, let's go, and away we went. I mean, they were great. But
Yeah.
that was a 911 call, and they asked me, was I okay going to Fairview? And I said, yes.
And that's exactly how the system is supposed to work. What you mentioned is that her husband was quite unwell, and when EMS arrived, they felt that he would best benefit from going to Fairview. And in some cases, that's absolutely the right thing to do, and I trust our local EMS to do the right thing and to get patients exactly to the right facility where they belong. And that's not a change, that's what they've always done. That's the same status quo as you have always done for many years. Yes, sir?
I have a question for both of you. I don't have Medicare or Medicaid or private insurance. I'm covered by the VA. If it wasn't critically urgent, could you take me directly to the VA emergency room?
We have transported to the VA before, yes.
And, for you, if I had to go to the Lakewood emergency room, can you directly access my medical records at the VA?
Unfortunately, VA is also a Meditech, so we can't access those medical records. But if you have a condition that requires emergent treatment, I can call over there and get a nurse manager 24 hours a day and ask her to fax those things over with your permission, of course.
I have internet access, I signed up for it. I have a username and a password to access my medical records.
Oh, that's great. Yeah, if you have the ability to do that, then we can wheel a computer. We've got computers on wheels all throughout the department that go directly to the bedside. We can just put it a little bit lower and have you log in and print it out. Yeah, that's great. I didn't realize that was an option. Fantastic. Yes, sir.
If a patient's transported to Lakewood and it's determined they have to be admitted at, say, Fairview, does Medicare or insurance pay for that second EMS run?
Yes.
And when the person is discharged, we have some residents who really don't have family to bring them back. How do they get back to Westerly from
Sure.
Fairview?
No, it's an excellent question. So the question was, so what if you need to be transferred? What happens? Who pays for that second EMS run? And so with Medicare, Medicaid, I know the VA does this as well as all the private insurances. That's considered a medically necessary treatment. So just as if they took your appendix out and you needed surgery, it's the same thing with insurances. So that's considered a required thing to get you to where you need to go. I'm going to knock some wood. No, this isn't wood. I haven't had a single denial or complaint of a denial so far. And I know that Medicare in particular pays for 100%. Obviously, everybody's insurance product is a little bit different. So if you belong to Humana or Aetna or one of the other HMOs, you may have a different contract rider, and unfortunately, it's impossible for us to know 100% of that information. But I haven't had any issues with seniors being transferred from our facility to, say, a Fairview or a Metro. I haven't heard that that's an issue at all. Now, with regard to how do you get them home? And that's a great question, too. We have a fleet of social workers. I actually came from Fairview as an emergency physician. They have one of the most busiest, most active social work centers in the entire Cleveland Clinic. They're really good. They'll find a way. They'll get you, if you require an ambulette, they'll call an ambulette and, do the paperwork to get that paid for. If you require a cab and prefer to go home that way, then they'll make it happen. We've had a couple of people who've had some very special needs that we've sent over there. There was a young mom who required surgery and needed care for her 8-year-old son, and she's all by herself. So we actually had social work coordinate with Providence House to take the child overnight and to give him safe lodging for free. And when mom was discharged, social work gave her a bunch of cab passes and a couple gift cards for Giant Eagle, so she could have groceries for the rest of the week until she got paid. So that's kind of one of the kind of like heartwarming stories of how you know, we have this great integrated system and we really care about people and want to do the right thing for people. Yes?
I drove my girl to, tap transfer to the hospital. The ambulance service was Donald Martin. Is that private?
Yes, yes.
Donald Martin's does the vast majority of the transfers for us, and they are a private ambulance company. But there are other private ambulance companies that will also provide that service in addition to Cleveland Clinic Critical Care Transport Team and Metro Health's Life Flight will also provide ground ambulance transfers as well, depending on the circumstances.
Be charged by the mileage.
You know what?
Martin's requirement to be charged by the mileage.
Lakewood EMS only brings people to the hospital for now. They don't actually take people out of the hospital for transfers. So no, all our transfers are performed either by critical care transport service or by private ambulances. But I haven't personally been told that there have been any service denials or additional payments that people have come in. And again, like, you know, I've been in this particular area for 10 years working around Cuyahoga and Lorraine counties. I've never been told that that's ever been not covered because it's considered a medically necessary service.
Ambulance service is not covered.
Yeah.
And $155
Yeah.
to the nearest hospital.
Yeah, no, that's not surprising. And that does happen with certain riders in insurance. You know, kind of looking at something like that, I think for me personally, kind of knowing that that was the case, I would consider when you have your next open enrollment period, doing some research on other insurance products, because that is pretty high. I mean, the average cost though, like if you were to get a bill, let's say you didn't have any insurance at all, for an ambulance transfer, I think is around $600. So, you know, that's very, very pricey. So $265 is a discount on the normal rack rate, but that's still a horrendous amount of money to be paying for something that you really need to save your life. So unfortunately, sometimes insurance companies will do stuff like that to cut corners and to sort of cut costs. And I think the only way to get around that is to vote with your feet and to do a little bit of research and to find another program, another insurance program that can better meet your needs. So I'm sorry to hear that. That is very, very high. And that's not surprising.
And nobody here should ever, if you need us to take you to the hospital, don't ever worry about the cost. I mean, we have mechanisms in place that can take care of that for you. So don't hesitate to call the Lakewood Fire Department for your ambulance. If there's a problem with the cost, if we tell us, we have mechanisms in place that can address that, and we have done it. I get calls like that all the time about people who are having problems, and we find a way to solve that problem for you. So don't ever hesitate to call if you think you need an ambulance, because we will find a way to solve that problem. Yes. So, as she said, there are service coordinators, and they work with the city with the bills. And if there's a problem, you just call and ask for the fire chief, and I've taken care of it for any number of people where there was a hardship. And all I just tell is I just tile over the finance and we take care of the problem. Yes?
I worked for 15 years with Kaiser, and I worked at Metro, and I would get a phone call, I'm having chest pain. I want to see only my doctor. And it would be somebody elderly, before I felt I was elderly. And I would think, I would think, well, you gotta go. But the thing of it is, when you're worried about paying $300, and we would have to tell them, the nurse would have to say, you have to call 911. And we've had people that absolutely would not go because of the money. Their money is so tight, and that's what the fear is for a lot of people. That's a huge charge. And one lady said to me, it's not worth it unless I die. That's exactly what she said to me.
Well, for me, it should never be anything that you should be afraid to call the Lakewood Fire Department ambulance. We're gonna take care of you to the best of our abilities, and we're gonna get you to the facility that's gonna provide you the care that you need. Most of our care that for our patients is Lakewood, and we'll get you where you need, and We did not get into the business of running EMS to make money for the city of Lakewood. When the fire department took it over, we knew it was gonna cost us more to operate the service than we gained back. Now, we do make more back than they made back in '99, but still, it doesn't cover our costs. But that's one of the services that the city of Lakewood has chosen to provide to their citizens. And the city works very well. We get all the equipment we need. We just had training today on new equipment that we're gonna be putting in service, and we've got more new equipment that we're gonna be putting in service later this year. We have a replacement plan for our ambulances. It's all factored into the cost of operating our system. But no one should ever fear about getting held accountable for a bill and hesitate to call 911. We have a way, the fire department, we never come when everything is going right. We usually only come when something's going wrong. So if something's going wrong with the bill, if we can figure out how to put a fire out in the building, we can figure out how to solve a problem with a bill. So, and don't ever hesitate to call if you need an ambulance.
Occasionally, we have residents that will fall here in the common areas. We will call 911, EMS shows up, and the resident refuses to go. They say, I'm okay, and maybe they are. Is there a fee at that point for a call that is turned down?
We have what's called a treat and no transport fee, but we don't apply that here at the Westerly. The intent of that is something completely different. So if you fall and somebody needs help getting up, we pick you up and decide you're okay, there is no fee for that. But you're gonna get checked out because we don't wanna leave you and have you find that, oh well, maybe I did break my hip 4 hours later and decide and have you sit there in pain. So if they pick you up, they're gonna ask you a whole bunch of questions and they're gonna take your vital signs. And if they don't like something they see, they might try and talk you into going to the hospital even though you don't think that you need to. But the paramedics are very highly trained and they use very good judgment. They're not gonna force you into the ambulance or come up with some kind of fee because we're trying to make money, because that's not the case. If somebody falls and needs help getting up, then by all means call, and don't tell them I said this, but we'll come over and we'll be happy to pick you up, but you will get an assessment, but there is no charge for that.
What if the resident gets to a hospital and there's a mental health dementia issue? What is happening now?
That's a very common scenario. That's something we're used to the question was, if there's a mental health or dementia-related problem with somebody who comes to the emergency department, how do we handle that? Actually, we handle that all the time. The elderly are the fastest growing number or type of patient that we handle, so we're very sensitive to the needs of seniors in our emergency department. We do our best to get information from other sources if the patient can't tell us themselves. So we'll call over here and say, if it's a skilled nursing facility, we'll call the nurse who's taking care of the patient and ask questions. So what happened? What was the circumstances? We talk to family, we talk to their private doctor, we review their medical records in great detail. Sometimes it's a lot harder to get that information, but we know it's the right thing to do, and we do it to get that data that we need so that we can care for the person in front of us.
RHIP, you're in my auditorium, so I get to talk. My name's Larry Fallhaber, for those of you who don't know me from being around here a few hundred years. I was lucky enough to hear the doctor on doing a program like this week, and one thing she does is listed all of the things they serve through the emergency room, and she kind of hit them, but it'd be good to summarize that at the end. I think it's a good
There is nothing we don't treat in the emergency department at Cleveland Clinic Lakewood. In the last 2 months since the hospital closed, we received a young man who was shot by a gun and came in with life-threatening trauma to his leg. We've treated a couple heart attacks, strokes, someone who bled into their brain. You name it, if it's an emergency, my emergency docs can take care of it. They're all board certified in emergency medicine. What that means is they have received 3 or 4 years of additional training beyond medical school to learn the art and science of treating sick people. We're some of the best in the business. They've all been vetted by the Cleveland Clinic. They are a great team of A+ surgeons and physicians. They're really good at what they do, and I'm proud to be their leader. You name it, we take care of it. Mental health, behavioral health stuff, we take care of alcohol and drug related issues, we take care of complications of diabetes, chest pain, abdominal pain, headaches, weakness. But I just don't feel right. Those aren't my favorite workups, but we do them. People who just have simple things like a little cut or urinary tract infection or a cough that maybe is pneumonia. Especially if you call your family doctor and they tell you it's going to be 2 weeks before they can get you in and you're really worried and you don't feel good. We want to see you because we can take care of it. Whatever your complaint or issue is, be very assured that the physicians over at Cleveland Clinic Lakewood are capable of handling your complaint. And we welcome each and every one of you to come and see us if you feel you need our services. Oh, the diagnosis of stroke. So that's kind of a contention point. I know there's been a lot of misinformation about can we treat strokes at Cleveland Clinic Lakewood? And the answer is absolutely. We have exactly the same telemedicine system that they have at Fairview, Hillcrest, Lutheran. It's really, really cool. It's a Skype connection, which I don't know if anybody's familiar with that, but it's kind of like 22nd century crazy Jetsons kind of technology where the neurologist at the main campus Cleveland Clinic, who is a specialist in stroke medicine, will see you and you'll see them through a TV connection. We'll do an assessment with you and kind of help walk you through it. We'll obtain your CAT scan, your blood work, and talk to the doctor along with you. And then if you need the medicine to treat a stroke, something called TPA, you'll be administered that medication right on site. And the problem with TPA is you got to be on top of things. This is a sort of medication that needs to be administered within 3 hours for most patients and within 4.5 hours for a couple other selected folks. So you really don't have time to wait. As soon as you think somebody has a stroke, or if you're afraid you have a stroke, call 911. Come and see us. We will get things done faster than really anybody else. And we will have the same resources in place to make sure that you get the best care you can using the resources of the Cleveland Clinic. Yes, ma'am?
Are you still doing blood tests and mammograms?
We are. Blood tests and mammograms are part of our outpatient facility, and all those can be accomplished there. Yes?
The next time there's voting, isn't there an issue about voting, something about labor housing?
I'm going to pass the mic to the chair, the chief.
There was a referendum on the ballot in November to repeal the ordinance that was passed by city council. I don't do any more on it than to say that.
So what do you suggest we do? You vote for?
My role is to tell you about emergency medicine and what the fire department can and cannot do. And I'm not trying to cop out. I have my opinion, but as the fire chief, my fear is to make sure that everybody understands what the fire department can do and what Dr. Welch's emergency room can do. Whatever else is, I stay out of the political point. My interest is in what's best for the citizens of Lakewood. And from my perspective, what the services her ER provide are equal to what they were before the inpatient beds left Lakewood Hospital. And the big reason we're here is because there's so much misinformation, we wanted to clarify that. And one of the things that she left out about stroke is the same diagnosis of stroke that's done from the Lakewood ER will be done by the same doctor in Fairview, in Hillcrest, in Lutheran, or in South Point hospitals. And if you're at any one of those hospitals, the chances of you needing to be transferred are about equal. So if you were to go into the Fairview with a stroke, we know you're going to be transferred here, you may need to be transferred out of Fairview or any one of those other hospitals. And it's simply because some of the procedures that are performed aren't performed at any place but Metro, University, or main Cleveland Clinic. So they do good work. I hope that Lakewood Fire Department does good work. If they don't, I want to know because I'm going to make sure they do good work. So, but to comment on the referendum, mine is just to make sure that you have the right information about pre-hospital care and emergency care. That's been my position all along.
I wonder what would happen if Lakewood...
I'm not going to answer that question either, but one of the things that was on the title of this program today was just the facts. And so what we're trying to do is get out the facts, which I will say you're not reading the Observer any facts That's the way I feel about it. But anyhow, I do want to mention, on the bulletin boards for several weeks now has been a list of the outpatient services. Cleveland Clinic Lakewood, the building across the street, is what we call outpatient services at the Cleveland Clinic Lakewood. And for example, right now, at the top of the list is the emergency department. You've heard about that. They still do cardiovascular testing, stress testing, EKGs, I'm not going to go through all those monitors, chronic care clinic. We still have laboratory services, general neurology over there, radiology. There are about 250 employees of the Cleveland Clinic working in that building as we speak today. So there's a lot going on. It's not an empty building, it's busy. So those are going on. Then there's also the Lakewood Professional Building, which is up on Detroit Avenue also, which is where the Diabetes Center is and the Teen Health Center. They're both in that building, which is listed as Lakewood Professional Building now. Then there's the Community Health Center, which is across the street on Bell Avenue. They still have a senior assessment program, and they still have the Women's Health Center. So those are all the things that are still going on. And actually, the YMCA is running rehab, still provided by Cleveland Clinic Lakewood. So there's a lot going on. But I want to thank, I know I said Sally was going to wrap this up, but I want to first thank Scott and Judy for coming today and giving you the facts, and that's important. We're working our way up the line, the service coordinators who put this all together. We have Debbie over here, Sally and Paul, and they're always available to get you information, and they'll get you the facts too, that's important. And then we have regional communications for the Cleveland Clinic as well. We have Jennifer, Marilyn, and I know I should know their boss's name back there, but she came here today to hear the first of these programs that their department is putting on around the city to make sure people get the facts, and that's important. So, in answer to your question, I think before you decide to vote on the issue in November, get the facts, and that's how you should make your decision. So thank you for coming, thank all the participants, and Kurt, do you want to say anything? He's kind of my boss, but been around here a few years. Actually, 20 years, we figured out, Rosemary and I figured we've been involved since I retired. It's 20 years in April of this year, since 1996. So, and then 20 years before that, I started full-time here. So that means I've been around a long time. Thank you, kids. Thank you all for coming.